This is Dr. Bhupesh from Dr. BKM Institute. Today, again, we have a letter which is quite good and it is just a two-page letter. Of course, if we write all the words, even then it's going to be fine. It's just about making few alterations in this letter, but that is how visit letter goes. Always remember that for the new people, I'm telling them this visit letter pattern. Visit letter pattern is always like this. So in the first paragraph, you will mention about the purpose. That is how OET is. Whether it's a discharge plan letter, it's other letter, don't try to classify too much that it is a discharge letter, it is a visit letter, or it is this or that. But I'm generally telling you that when a letter comes in the form of visits, that is what I mean by visit letter. So please, if you classify the letters, then you start cramming up or mugging up, which is bad. So I'm just saying in a simple way. So if something like comes in the visit, so it is very simple. In the first paragraph, we in OET, we always write about the purpose. So I'm writing this letter regarding this person, whatever the name is, regarding Mr. X, second name, Mr. X, who was, who has been, who has been suspected with this particular disease on the basis of no commas, nothing, on the basis of his current signs and symptoms. That is the first line you will always make out of this thing, because this tells us about the purpose. This is the has been means we are talking about present. Been plus third form means it is a passive voice. That means I am writing this letter regarding Mr. X, who has been suspected by our doctor, by our hospital, by our clinic. So that is basically a passive voice. Be plus third form. Has means it is present perfect. Has plus third form means it is present perfect. That means we are saying कि ये लेटर लिखा जा रहा है या मैं लिख रहा हूं उस पेशेंट के रिगार्डिंग, मिस्टर एक्स के रिगार्डिंग, जिसको सस्पेक्ट किया गया है ऑन द बेसिस ऑफ करंट साइंस एंड सिम्टम्स. अगर सस्पेक्ट की जगह डायग्नोज्ड वर्ड दिया है, जब सस्पेक्ट तब लगाना है जब क्वेश्चन मार्क दिया है. व्हेन क्वेश्चन मार्क इज गिवन देन यू से सस्पेक्ट, और यू कैन आल्सो से प्रोविजनली diagnosed with. You can also write provisionally diagnosed with. If question mark is not given, then you make this word rub. So who has been diagnosed with this disease on the basis of his current signs and symptoms. So he is being referred to you, referred under your expertise on urgent basis, and that's it. Otherwise this is also and your, that is fine. That is all good. Now you can well understand. See, there are things which are interconnected in medical profession, which you also know very nicely because you are medical professionals. But there are few things we miss. Why do we miss? Because we do not make the images. Again, yesterday I was talking about the images, so I will give you an example of image. Even this, आई एम राइटिंग दिस लेटर, मिस्टर एक्स जिसको डायग्नोज किया गया है इस बेसिस पे करंट एंड सिम्टम्स के, इसलिए हम आपके पास रेफर कर रहे हैं ऑन अर्जेंट बेसिस. मोस्ट ऑफ द टाइम आप प्लीज इमेजिन करके देखो, प्लीज इमेजिन, मोस्ट ऑफ द टाइम्स when patient is paying visits, that means we are not a hospital. Obviously, you understand, if we would have been a hospital, we would have admitted the patient and would have discharged the patient, and in that case we would have written discharge letter. If you try to connect it, if you try to open your mind, that is what OET is all about. It is purely practical. So you are writing a discharge letter most of the times when you are a hospital, and in that case most of the time it is a follow-up care. Most of the times, I am not saying always. Always is nothing. Never put anything in always. In this life anything can happen, anything may happen. Never put anything in always. So that means the patient was visiting us, we were not hospital. If we would have been a hospital, then patient would have been admitted, would have been discharged, and we would have written a follow-up care. But what has happened is that we are a clinic, so we have not been able to handle the patient. That's why we are writing the letter to a senior doctor, to an expert, on urgent basis. And this time patient might be going to a bigger clinic, bigger surgery, as surgery is equal to clinic. So never consider, in foreign countries we call it surgery, we do not call it clinic. So either the patient would be going to a bigger surgery, or maybe would be going for a bigger hospital. So that is how you can arrange. So you tell the purpose that sir मैं आपको letter इसलिए लिख रहा हूँ क्योंकि आज patient को हो गया because patient is having these problems today on the basis of his current signs and symptom. So he is being referred under your expertise on urgent basis. Second paragraph you say Mr. X is a social worker, whatever you want to say, social history and medical history. You can also write it is deciphered from his medical history. You can also use this word. It is deciphered from his medical history that he is having, yeah, he is having diabetes. If you want to mention the time, you say, if you want to mention the time, so has been having diabetes since last 10 years. So that is how you can write. So that is what is the point of writing, that is how you make a good paragraph. And when you make social history and medical history together, so you say besides, but it is not going with it is deciphered, so we don't need it now. That's fine. So Mr. X is a homemaker, whatever you can say, is a homemaker, and this and this, full stop. Also, it is besides nahi, apart from this, it is deciphered from his, apart from this, yeah, this connector is looking fine. Apart from this, it is deciphered from his medical history that he is having this, so this can fit in. This is looking nice. अब एक बार पढ़ के हमेशा आपको रिवीजन से ही पता लगेगा whether you have written good or bad. So I'm writing this letter regarding Mr. X who has been suspected with this problem on the basis of current signs and symptoms. That is today's problem. That is what is the purpose. That is why we are referring the patient. Mr. X is a homemaker and this and this and this and this. Apart from that, it is deciphered from his medical history that he has been having diabetes since last 10 years. Now it goes fine. On first visit. On first visit, you mention the date, which was, so you make the connector out of it, which was on this Tariq. And always write, don't, Daman ma'am, you also write 24th. So don't write this way. So you say 24 April, you don't put this 2009, you put it this way. So on first visit, which was on 24th April, 24 April 2009, the patient was having, so that is how you will write the first visit. The patient was having this and this problem. Also, he was suffering from this and this problem. Then you can say this way, he is suffering from this and this problem. Then apart from this, you will say on examination, then it is about a passive voice because examination would be done by us. Examination हमारे द्वारा की जाएगी. Now we will make a on examination he was found with. So be plus third form, was plus third form. That means now it is a passive voice like be plus third form. Be plus third form. Now here it is also be की second form, that is was plus third form. That means he was found by us. But we do not write by us, so we are not writing it. So he was found with. Then you talk about the signs because that is what we find when we do examination. So these are the signs. Symptoms would be discussed here. The patient was having this, also he was suffering from, these are the symptoms of the first visit. Then you say he was found with this high temperature and tenderness. This is also sign, tenderness is also sign. So you say this and that thing. So he was provisionally diagnosed with, provisionally means at that time. So he was provisionally diagnosed with, if there is no question mark given, if it says assessment, if it says no question mark, if it says assessment, then you say he was assessed with. So you change your words according to what has been given. जो आपको दिया है वही लिखना है. So he was assessed with this problem for which PCM was advised. So that is how you write the medication. So this is the way of writing visit letters. So this is the, it will always be like this. On first visit, which was on this, the patient was having this. Also, he was suffering from this. You mention the symptoms. Then you say signs. On examination, he was found with this. So he was assessed with this for which PCM was prescribed. Then after 5 days, suppose the visit is after 5 days and that is his second visit. After 5 days, he again he revisited and complained of same problems. ठीक है, he revisited ऐसे भी लिख सकते हो. You can also write he revisited with worsened symptoms. Also, he said that he was also having. Never say is. Till the time today will not come, there will not be anything in the present. It might appear to you that you should write present, but always convert all the present tense in the past until you reach the today point. So also he said that he was also having this and this thing. So again, on examination, so you say on assessment. So you want to change your word. So rather than examination, this time you write on assessment. He was found with, or you want to change it, you want to paraphrase it. It was found that he was having tenderness and whatever the signs are. He was having these and these signs. So you mention the signs here. So now you want to change this thing as well, because see, these are the small changes you do on examination, on assessment. He was found with ki jagah, it was found that he was having these and then signs. So he was provisionally diagnosed. So you want to modify this as well. So provisional diagnosis of जो second number पे disease दिया, second visit में disease दिया, of this disease was made. Now this is a complete line. This is the subject. Provisional diagnosis of this particular disease was made. Was made, again passive voice. That means was made by us. That is means by the doctor or by the hospital. But we don't have to write by. So we omit these things and we say provisional diagnosis of this was made. Normally we say he was provisionally diagnosed with, or you can make a noun out of it and you can say provisional diagnosis of this was made. And for which ki jagah, and for it, and for that. So you make the variation again. So when you make the connector which, you cannot put and. When you do not use the word which, then you say and for that, जो भी next medication was given, was prescribed. So that is how you make small variations. So you can learn this, that is okay. Then you make the fifth paragraph. Normally we make four paragraphs, but you can also make fifth. Today he has, now it comes to the present, he has presented again and he's having this and this problem. On being examined. So this is the variation you do in the present tense. On being examined. That means I want to use ing to say it continuous. Continuous means I'm talking about present. On being examined, he has been found with. So was का बन जाता है has been. So was is converted into has been in the present. Was has been third form. That is what we did in the start as well. This was present. So this again is now present. Over here in the past visit, there can be nothing present. Nothing can be present. So on being examined, he has been found with, अब आज के signs. So he seems to be a case of, या फिर आप एक अच्छी लाइन भी लिख सकते हो अगर साइंस छोटे हैं. सपोज यू से साइंस छोटे हैं. He has been found with high lethargy, tenderness, this and this, which if you want to write nice, which makes him continuous, मतलब ये continuous sentence will be continued. He has been found with this, which makes him a suspected case of, if you want to write better, which makes him a suspected case of this problem. So last line, so your expertise is highly required. So that is how you write the letter which comes in visit. So he has presented again. अपने आप आया है. There is no passive voice. He has come by himself. So no passive voice. He has presented again and he is having this. On being examined, he has been found with this, which makes him a suspected case of this disease is the same one that you have mentioned. This is the only thing that will repeat. That is the only thing in the first and the last paragraph would be same. So your expertise is highly required in this case and would be highly appreciated as well. That's it. So this is the complete letter. This is how you write visit letters. So please listen to it 3 times. That is why I always say 3 times. I don't say 2 times. I say 3 times because there were few things when I was discussing the previous thing. I was saying would have been, discharge letter. So you learn the tenses automatically. Would have been कहाँ पे लगाना है? Would have been is a probability कि अगर ऐसा होता तो, अगर ऐसा आता तो, if letter would have been this way, patient would have been this way. So would have been means we are talking about probabilities of the future. Would have been, if I would have been a king, I would have done this thing, I would have done that thing. If I would have been a prince, I would have done this thing. So everything is learned when you listen to it repeatedly. That is why I say listen to it 3 times. So I'm writing this letter regarding this and this. But if today की जगह visit एक दिन पहले हुई है, तो never mention date, always mention yesterday. These are the two things you have to take care in the visit letter. अगर visit एक दिन पहले की है, suppose today's date is 15th and this data is of 14th, always write the yesterday. So you will get marks for yesterday and today. So yesterday he revisited, today he has presented again. सो इफ इट इज गिवन, इफ यू हैव टू फाइंड योरसेल्फ, जैसे आप हिंदी या पंजाबी में और अपनी मदर टंग में बताते कि वो 5 दिन बाद आया, आफ्टर 5 days, या कल आया था सर, कल भी आया था, yesterday he came as well. So you can write whatever you want, but this is like the perfect way of writing a letter which is based on this particular thing. Now I will try to make it, which I normally do not do, but I will try to teach in a very different way. I will make a very good in kind of a sample for this letter. Like अगर आज का letter इसमें fit करना हो तो कैसे fit होगा? So how would today's letter fit in? So I will try to write it here only. I need to create some more space for this. Yeah, so that I can fit in those things, so that you can learn in the best possible way that how to fit in the letter in this pattern. So yeah, I'm here. So I'm just going to go back on this particular letter of mine. So I say, if it says, just a second, yeah. So if I go to today's letter and let's see how to fit in the pattern, this will make your job easier. So I have to read from writer lateral effort to Mr. Boo Delhi, orthopedic surgeon. So one first thing I have realized, again, the first thing in the exam I will realize is to whom. So this says orthopedic. So I always automatically understand that something related to the bones, to the movement, to the hips, to the joints can happen. So I have to mention this thing. So subjective sentence, little improvement in the height, difficult to get around, decreasing assessment, osteoarthritis, not responding to inflammatory medication, and possibly needs hip replacement. ऑर्थोपेडिक सर्जन को लिख रहे हैं फॉर असेसमेंट एंड एडवाइस. सो ऑस्टियोआर्थराइटिस और इम्प्रूवमेंट, और ये क्या है, डिक्रीजिंग रेंज ऑफ मोशन इन द हिप. सो आई विल ट्राई टू राइट द सेम थिंग्स. So I am writing this letter regarding this patient who has been, I'm right, so this letter will go, I'm writing this letter regarding this patient who has been suspected or assessed. What was the word given over there? That was given assessment. So who has been, who has been assessed with osteoarthritis. वो इस जगह पे, who has been suspected osteoarthritis, which is not responding. So which is the word that you will add, which is not responding to anti-inflammatory medication on the basis of his current signs and symptoms. Neha ma'am, please do not play up on the basis of signs and symptoms. So he is being referred under your expertise on urgent basis. So that is how you write, who has been suspected, who has been assessed with osteoarthritis which is not responding to anti-inflammatory medications, hence the patient is being referred to you. You can make you can make it better as well. What you can do, because this letter, again, that is why I say do not try to grade the letter, because it stops your creativity. So in this letter it is very important to tell about the hip replacement, because the patient is majorly, because patient might majorly require hip replacement. So it says orthopedic surgeon possibly needs hip replacement, so this thing should also be there. So I'm writing this letter regarding Mr. Smith, who has been diagnosed with osteoarthritis which is not, comma डाल के, which is not responding to anti-inflammatory medications, and also he has decreasing range movement in the, decreasing movement in the right hip. So he is being referred under your expertise for assessment and your expert advice, and also he might need hip replacement. So I have to mention this hip word to make it better. Otherwise, osteoarthritis is a very general term. Then we cannot write about hip replacement. So we should include this thing. So I'm writing this letter regarding Mr. Smith, who has been assessed with osteoarthritis, which is not responding to enter, and also he is having decreased range of motion in the right hip. So he requires your expertise, and hence is being referred to you for assessment and advice, and possibly and he may need, possibly word ko hata do, and he may need hip replacement, or he might need hip replacement. So that is why I say do not cram things. You have to use your knowledge. If you're mentioning about the hip replacement, then you should also mention about right hip. You cannot mention it for osteoarthritis. That is where the marks are deducted or added, because we cannot say, sir, we followed all the pattern, we did our best, how did we lag behind, how did this happen. I did not take your exam. I cannot say what you have done in your exam. So you have to be particular about your exam. That means you need to tell what is the right problem. You just cannot be, doing anything and you say, I have followed the pattern. It's not about pattern. You need to keep your minds open. So you say, I'm writing this letter regarding this person, Mr. Smith, who has been assessed with osteoarthritis, which is not responding to anti-inflammatory medication. Don't write current signs and symptoms. Rather include, and also he is having decreased range of motion of right hip, so he is being referred under your expertise for assessment and advice, and also he may require hip replacement. That is how I will attempt in my exam. Again, listen to it 2 3 times. That is how I will write it. Then it becomes simple. Then we write about the social history and medical history as per our pattern. So social history says 72-year 2 month history of the right pain in the hip knee. So we will say, so इसमें कोई social history or medical history नहीं है, first visit में आ जाएगा. On first visit, which was on 13th November 1991, 13 November, not th, 13 November 1991, he reported that he had 2 months, has नहीं had. मैंने कहा है everything would stay in the past, everything past में ही रहेगा. So on first visit, he reported that he had 2 month history of severe pain in the right hand. Also, he was having trouble with the right hip, but could bear his weight normally. लेकिन अपने वेट को बियर करता था, बट सब कुछ नेगेटिव लिखा है तो पॉजिटिव बात को लिखना है, तो नेगेटिव और पॉजिटिव के बीच का कनेक्टर. सो व्हेन देयर इज नेगेटिव एंड पॉजिटिव, और पॉजिटिव और नेगेटिव, दैट कनेक्टर इज बट ही कुड बियर द वेट, बियर हिज वेट नॉर्मली. वो अपने वेट को, उसका हिप खराब था, मतलब कि उसका हिप खराब था, लेकिन फिर भी वो अपने वेट को उठा सकता था. Pain increased over the pain, no relief with Panadol. On examination, he walked with limp. Don't write about the temperature, and had decreased internal rotation and flexion of the right hip. That's it. On assessment, he was, या फिर, so he was assessed with osteoarthritis of the right hip, for which X-ray was planned, and X-ray was planned, in which degenerative changes consistent with osteoarthritis was found. मतलब जो भी आपकी फाइंडिंग होती है, आपको ये तो पता ही है was found लगाना है, because आपके द्वारा पाया गया है, it has been found by we. So how do you make the rest of the line? You say X-ray was done, in which, you write in which, जिसके अंदर, in which degenerative changes consistent of osteoarthritis, you write the complete line, was found. So that is how you make it simple. So you fit in this complete thing over here. So please listen to it. Then you would be able to trace it nicely and easily. It will not bother you too much. So you put this particular sentence in this particular space. Then you move forward, and for that, course of indomethacin was started. 13th 11th के बाद he has come on 12th month, 12/1. So that means after 2 months. After 2 months, he revisited and had flare up of right hip pain, and reported that he had ceased his medication on his own 6 weeks ago. This person came to us on 2 months ago, and 6 weeks ago he stopped the medication. That means 1.5 month ago he stopped the medication. So that means he had stopped the medication, एंड सो मतलब सिर्फ उसने 15 दिन मेडिकेशन खाई और बाकी कोई 6 हफ्तों से मेडिकेशन ही नहीं खा रहा. On examination, he had decreased range of movement and was unable to bear weight. So he was assessed with exacerbation of osteoarthritis in the right hip, for which indomethacin was recommenced. So that is how you fit in. It is all going according to the pattern. So he was assessed with this, for which indomethacin was recommenced. After 6 days, he came back and complained of dyspepsia. So the medication was changed to Mylanta and Titocol was added. Just write this much. Don't try to explain this too much because this is mainly about osteoarthritis. This is telling us nothing rather than just the same condition. But the patient, this visit is only for the medication. So just tell the orthopedic surgeon. So that is where you decrease your words. So you don't mention about anything that is this pain, no relief with Panadol. You can write, but you can avoid as well. Don't write normal thing. Don't write normal thing. Don't write then this particular visit. You can just say after 6 days he came back and complained of dyspepsia, for which and due to which indomethacin was changed to Mylanta. That is again a passive voice. Was changed matlab by us, basically. Was changed to, yani was changed by the doctor. So it is a passive voice. Was changed to Mylanta and Titocol was added. So that is how you made small line was added. So today he has presented again with little improvement. Little means no improvement. Little means very little. So little does not mean there is improvement. So ये इसका मतलब ये नहीं है कि improvement हो रही है. So it says there is hardly any improvement. So he presented again with hardly any improvement and has increasing difficulty to get around. On being examined, he has decreased range of movement in the right hip. So assessment of osteoarthritis not responding to anti-lateral medication has been made. So I told you आपको pattern में fit करना है. So provisional diagnosis of this has been made, for which your expertise is highly required. That's it. That's the complete letter. So that is how you fit in the complete letter in the same pattern we have written, and there would be no problem at all in understanding this visit letter pattern. So this would be all simple. It will go according to this. So on being examined, he has been found with decreased motion of the right hip, which makes him a suspected case of osteoarthritis, not responding to anti-inflammatory medications. So your expertise is highly required in this case and would be highly appreciated too. Appreciated की spelling ठीक कर लेना please. Please correct the spelling of appreciated, and that is how the things will go. Is it all good? Have you all understood? Do you have any doubt? I will take your doubts because this is a big recording today. I have explained the whole visit letter pattern. So I will do and I will stop the recording and will take your questions, of course, and then we'll jump on to the reading part after taking 5 minutes break. But first I will take your questions regarding the writing. So I'm stopping the recording and putting you on mic, so that unmuting your mic so that you can talk to me. Thank you. This is Dr. Bhupesh from Dr. BKM Institute.